Okay. Hi, I'm Dr. Ben Snell. I'm the managing physician at Twin Rose Family Medicine. I want to talk a little bit about the ramp up to turning our practice, which was pretty much all in person, to a very much online platform, all in the setting of this pandemic that's really affected so many of us. So back at the end of March, when this all happened, we realized quickly that it was no longer safe to see patients in person. And we weren't really clear, as we are now, about how this virus was being transmitted or what it would take to keep things safe. So we knew we needed to shut things down as we did nationally, but then we also knew we needed to continue to provide excellent healthcare to our patients. So figuring out how to do that, we had this platform, Blue Jeans, that we decided that we would use. And we, rather than, I think many of us, our instinct was to turn inward and lock down and kind of shut the doors. Our instinct here at Twin Rose was really to continue to be available to patients, continue to provide care, knowing that people are under incredible stress with everything that was going on, but do so in a way that was safe. So it was, of course, the challenge was trying to take patients, many of whom are elderly, not the most technologically savvy, many people living in poverty that don't have access to all the nice apps or technology that others may have, and help them to still connect with physicians, PAs, nurses, our CSS staff here at Twin Rose, and communicate. So we, when this all started, the memory is funny because we did meet in one big room, which in retrospect probably was a bad idea, but we got into one big room, and I remember standing up, and Dr. Simmons, our regional medical director, was there also, and basically stood up and said, you know, everybody, we've got a crisis here. We need to still provide healthcare to people, and we need to make a big shift. And so we're not going to do visits in person anymore. We're going to do them in person. We're going to do them on video. And for the most part, we really want to avoid bringing people in, but we still want to reach out to people. So we had every single clinician in our practice kind of comb through their schedules, figure out who absolutely had to come in, for instance, like a prenatal patient, what patients we could do video visits with, which we were trying to do basically everyone that way, and then which ones, okay, this is something we could put off a little bit. And they all kind of got down to that individual nitty gritty, worked with the individual nursing staff. And then the real work started, which was reaching out to patients and help them actually connect with this technology or with the app or what that was going to look like. And our staff, our medical assistants, our LPNs, our CSS staff, they became like Apple tech workers and kind of learned the ins and outs of how to download an app onto an Android and an iPhone and whatever type of device people were using, and then how to sync that with connecting with us and time it up and get it set up so they could see the physician or APC that they're going to be seeing that day. And it took a lot of time. I remember some that were taking up to 40 minutes to get patients connected, but there was a real attitude of we can do it, we can make it happen for the patient, and we can help them get good health care. So one of my favorite memories, and I use this as a motivator because it was really, you know, if you can't, this is a classic problem-solving issue where if you run into one roadblock, you just keep trying new things. It's not that we give up. So, you know, and this was a classic scenario where that happened. I had a patient, she is 102 years old. She has an iPad at home, and she did wonderfully and did a video visit with me. Now, she took a lot of coaching from our staff to do that, but I said to our staff, if we can get a 102-year-old patient to get this done, I think we can pretty much help just about anybody. Telephones weren't in really regular use when she was born, so she did really well. So it was a wonderful process. It continues to evolve and continues to have challenges, but that same kind of problem solving. And then I think the mentality of really just trying to meet the patient where they are at is the thing that's made the most difference, and not being willing, or being willing to go the extra mile, being willing to look for alternatives. Now, today, for instance, we just had, you know, there are pop-up blockers that keep people from opening up their videos. Nurses are having to learn how to teach people how to shut off their pop-up blocker. They never thought in their LPN schooling that they'd be doing that. But these are the kind of things, the ways to be continually learning and adapting new technologies to help serve people. And it's really been a wonderful thing, and patients have been extremely appreciative I think we've continued to give people some really great care. So look forward to more of that, and it's a nice tool to use going forward.